Hello, everyone, and welcome to our Product to Practice webinar for Gentu. And thank you all for taking the time to join us today. I'd like to begin our webinar by acknowledging the traditional custodians of the land on which we stand. And for me, I'm based in Brisbane, so that's the Turrbal people and the Ugara people. And I would also like to pay my respects to elders past, present, and emerging. My name is Neve, and I am the GM of Product for Practice Management. Today, presenting, we will have Eden Howard, who is the Product Manager for Gentu. And we're also going to hear from Chris Grist, who is the Product Manager for the Gentu Marketplace. Today, Eden and Chris will be talking you through Gentu product roadmap updates. So they'll be sharing initially what's recently been released in what's new and improved. And then they'll also talk about what you can expect to see in Gentu over the next couple of months. Our session today is being recorded, so if some of your colleagues were unable to attend the session in person, it will be uploaded to our YouTube playlist by the end of the week, and then it's also going to go out as part of our fortnightly newsletter in the next couple of weeks. We will be running a Q&A, so at the bottom of the webinar box, or the webinar window, I should say, you'll see a Q&A box. If you have any questions that pop up throughout the webinar, please feel free to pop them in there. There's a couple of us online that will try and answer them as we go. And then if we can't get to them throughout the session, we'll have hopefully 10 or 15 minutes at the end to go through any questions that we have answered or any themes that are coming through in those questions, and perhaps even answer some of the ones we haven't gotten to live as well at the end. Now, before we jump into the product updates, we do just want to spend a minute sharing a bit about our platform vision, as this is really how we see ourselves helping you, the medical professionals, deliver better health outcomes over the coming years. And our practice management systems vision is really centered around a technology platform that we've been working on for a number of years, which is what's going to enable us to provide ongoing innovations to Gentu practices into the future. Now, some of these innovations we'll develop ourselves, but some of these will be integrations with third parties. And over the last 6 months in particular, we have been very focused on developing the foundations to allow other organizations or third-party products that you already use in your practice to be able to connect into and share data to and from Gentu. But the innovations that we're working on are really working towards 3 key objectives. The first is improving the patient experience by providing tools that can automate the patient journey and provide modern touch points for patients. The second is connecting up what we see as a very disconnected healthcare ecosystem today. We're conscious that every practice has to interact with many different parts of the healthcare ecosystem, whether that's pharmacies, aged care, pathology, radiology labs, or private hospitals. And we want to ensure that you have the data that you need at the point of care for the patient, readily available to you when you require it. And the third one is data-driven insights and AI. This is really about clinical decision support, workflow assistance, and insights that can improve your practice's performance. Eden and Chris will talk to you a bit more today about the first 2 objectives, because those are really the areas where we've made the most progress in the last couple of months. We're not going to share a specific update today on data-driven insights and AI, but what I can share is that we are exploring how we can leverage AI technology to streamline workflows for users. We're doing some early exploration on a number of use cases around clinical documentation, billing, and how we might summarize patient data for practices to get our practitioners, to get a faster understanding of a patient's clinical history. So we're really hoping to be able to provide you with a more detailed update on that when we get to our next product to practice update in July. The other aspect of our platform, though, is core Gentu. And so we know that the experiences across the appointment book, billing, and clinical record keeping are really important to users. And the team will talk as well today about, you know, what our focus is going to be over the coming months in uplifting those core experiences. So now I'm going to hand over to Eden and then Chris, who are going to talk to you about what we have done recently. Over to you, Eden.
Fantastic. Thank you, Neve. Hi, everyone. My name's Eden. I am Gentu Product Manager. Now, before I get started on our update, a couple of quick thank yous. Obviously, firstly, to Neve for the intro and a fantastic overview of our vision. Also like to thank our marketing team for my snazzy new profile photo and for my partner for finding me a shirt that randomly aligned with our Magentus brand colors. So I'll be taking you through updates for the core Gentu product, our platform interoperability offerings, and the Gentu mobile app today. But before we do get into those updates, I would quickly like to spend a little bit more time on the slide that Neve has on screen here and talk about not only these pillars, but how they actually inform the roadmap choices that we make and the changes that we're here to discuss with you today. So Neve did mention three major themes that underpin our platform vision and help us to define the work that we're going to do. So empowered patient experiences, connecting the health technology ecosystem, and providing data and AI-driven tools that make your insights actionable, minimize patient risks, and make practice processes more effective. So empowered patient experiences will be front and center for us as we discuss changes like e-requests and e-prescribing work that's happening now, as well as the work that we've been doing to support our marketplace partners, launching products that directly engage patients to book their appointments, keep demographic data up to date, provide informed financial and surgical consent. There is, at times a significant overlap between some of these strategic themes, and a connected ecosystem requires, a resilient end-to-end digital experience. And this ensures, a streamlined and time-saving handover between systems, practices, patients, hospitals, pharmacy, and government agencies. So as well as empowering patient experiences and more flexibility and choice, work like e-requests and e-prescribing also bring better connectivity to the ecosystem as a whole, as does work we'll be discussing today around e-bookings for procedures and the ongoing progress we're making with the Gentu mobile app as an extension of patient care. It's also a cornerstone of work that's happening in the core Gentu product to optimize outgoing communications from your practice to other practitioners, as well as members of your patient's care team. Our marketplace transcription partners are the forefront of our AI focus at the moment, but as Neve mentioned, we are doing a lot of work in data and insights that we hope to bring to fruition as the year progresses, and we'll be very, very excited to announce those pieces as they begin to roll out. It is very important to note for us that these are only inputs into the work they do, and there is one overarching outcome that really drives everything that we're going to be talking about today. So at the heart of everything that we're focusing on, how do we ensure Gentu practices can be more effective and more efficient? Everything that's going into to aligning with these pillars. For us, we're asking, how does this solve a real problem for our practices? How does this support them in delivering great patient outcomes and amazing patient care? How can Gentu evolve from being a product that helps keep a practice running into a partner that helps a practice grow? So with this in mind, let's jump into some recent changes and then into some releases that we hope you'll see in the near future. Okay, so earlier in the new year, we did release around 35 new letter references for Gentu, including some additional patient, recipient, procedure, and appointment data points. These were all based on feedback that we'd received from our practices, and there have been some real wins here, particularly in including additional contact options and email details for both recipients and for patients. Although we are very focused on a digital-first experience, we're also very aware these details can be particularly useful when letters are printed. It makes it easy to understand what pieces of paper go to whom, how they need to be sent out. So these new references are available when updating or creating letter templates, as well as within our letter writer, so that changes can be made on the fly. You can pull additional values into a letter on a case-by-case basis. So in line with our focus on greater connectivity in the Gen2 and the health ecosystem, pathology e-requesting is a digital patient experience that allows practices to create, send, and view digital pathology requests directly from Gen2. We've all heard, many stories from specialists around patients that can lose a paper request form, the additional overhead that comes with having to recreate those requests, print, scan, or email them back to patients who may not be in the practice. And e-requests not only connects those different pieces of the ecosystem together, but it also takes away that overhead by sending a request directly to our lab partners, who then send an SMS to the patient with the information that they need to go and get the test done. So to create an e-request, all you need to do is select a digitally enabled lab from the drop-down menu when creating your pathology request. And once selected, the request is sent directly to the lab and an SMS goes straight to the patient. So again, this SMS is sent by the lab. There are no costs at all for Gen2 practices. No SMS costs, no usage costs there. E-requests have been available for some time with Sonic and with Helios Pathology. We are very, very excited to share, though, we are now available in a pilot with ACL. We have a broader rollout planned for additional ACL sites over the coming weeks. Now, until recently, digital requests had only been available for pathology, and this makes it particularly exciting to update everyone on our progress towards e-requests for radiology. So our initial partner for rollout has been Sonic Healthcare, and Queensland X-Ray are live now. We do have other Sonic brands like SKG Radiology, Epworth Imaging, who will continue to roll out throughout April. In terms of how this works, the process is exactly the same as creating a pathology e-request. So when you are in your request workflow, selecting a digitally enabled lab will allow you to create, send, and view radiology requests. Once again, an SMS with the e-request details is sent to the patient, and this enables them to book in directly with the lab. And happy again to confirm there are no costs here for Gen2 practices. We are speaking with a number of other radiology providers at the moment, including groups like Loomis Imaging. And based on the rapid adoption of patient experiences like e-prescribing, we are very confident e-requests for both pathology and radiology will quickly become the industry standard. We now come to seamless e-bookings. Now, e-bookings, again, is a digital procedure booking workflow. It's currently available for HealthScope and ACHA. And seamless e-bookings takes patient and procedure information that you've already entered into Gen2 and shares this with the hospital bookings team electronically. eBookings was initially launched around 12 months ago in Gen2. We've had a lot of feedback and made a lot of changes in that time, but some of that initial feedback was very much that there was a disconnect there between the eBookings workflow and the core Gen2 procedure booking workflow. We've been focused on creating a more integrated and intuitive experience there. So you can see on screen that the Gen2 procedure screen has had some updates to capture additional e-booking specific information. And this includes things like practitioner provider numbers, consent form statuses. Other changes which are shown in the bottom right there, or may not be, that image may be slightly cropped out. But communication to and from the hospital bookings teams now shows directly in the appointment book rather than in a separate e-bookings theatre list. So we do have about 112 practices who are live with this functionality at the moment. Feedback that we're getting from them on this new way of working has been fantastic. They are loving how tightly integrated e-bookings is into their existing workflows, and we'll continue to roll this option out to additional practices in the coming months. So a quick call out there, if you do currently work at a HealthScope or ACHA hospital and would like to start using e-bookings, please let us know and we will reach out and discuss when this will be available for you. So the current focus of the Gentu mobile app has been to support obstetricians with pregnancy care on the go. And this is a super important part of our Gentu platform ecosystem. This is a way for us to support practitioners in extending care beyond the boundaries of their practice. We're happy to be able to provide access to additional information here about patients' pregnancy and antenatal care, as well as supporting practitioners recording information for births on their phone. And we feel this is going to be particularly valuable for people when they're called out for an unexpected delivery at some point late in the night. So at this point, what I'm going to do is hand over to Chris. I'd like to introduce him to the call. He is our Marketplace product manager, and he will take you through some recent updates in the Gentu Marketplace.
Hi, everyone. Just take a moment to take over the screen and make sure that's clicking through. As Eden mentioned, I'm Chris. I'm the product manager for the marketplace. And going back to what Neve mentioned at the start, we have been focusing a lot on connecting the digital healthcare ecosystem around Gentu. And so a lot of the work over the last few months with my team has been preparing the Gentu platform to enable more powerful marketplace integrations, ultimately to deliver you more practice efficiency and bring in some more automated patient journeys as well. So kind of crossing a few of those pillars from the vision at the start there. We launched the marketplace back at the end of October last year, and in the last couple of months, we've seen quite a lot of interest and uptake. But we've also heard your feedback on what has launched so far. And so we've been working to respond to that feedback and improve our existing integrations so that they help improve productivity. We really want to continue to improve and iterate on those solutions so that we have the best fit and best value for you with the solutions we offer in the marketplace. And as we know, in the digital health ecosystem, lots of change, new products and products changing over time. We want to keep up with that change and continue to deliver the best solutions through the marketplace. Alongside all of that, we're also working to bring more partners on board as well. And we'll look at both of those aspects now. And so first up, one of the items we launched recently in the marketplace is CoView. CoView offers a seamless telehealth workflow solution that enhances the virtual care experience. We know that some Gentu users were previously using the teleconsult feature. That wasn't a feature we were continuing to build on and improve. So we've made the decision to sunset teleconsult and focus on bringing a best-in-class telehealth solution with CoView. CoView offers a complete telehealth feature set, and you can find the CoView tile in the marketplace now. If you click through the marketplace through the book a meeting link, you can get set up with CoView. But you'll also find guidance here on how you can use CoView waiting room links in concert with Gentu's SMS schedules to automatically coordinate your telehealth patients. And then looking at transcription, we've had quite a lot of interest from a range of transcription partners, and we're happy to now offer 5 different choices in the marketplace and growing. Last quarter, we launched with 3 different scribes with Meadow, Lyrebird, and VoiceBox, and we initially only had a PDF write back for letters to store a record of letters, and we had really clear, strong feedback that you wanted to have an actual editable draft letter write back into Gentu. So we made that a priority to enable that for partners. And in January, both Meadow Health and Lyrebird implemented that letter write back capability. So you can now send a letter back as a draft into your outgoing correspondence in Gentu using your Gentu template. And I'll show you what that looks like in a moment. So Meadow and Lyrebird are both ambient AI scribes. If you've looked at these before and were waiting for those editable letters, both are now worth revisiting. Alongside that, we also launched with VoiceBox Intelligent Transcription by Avant. So it's a more traditional transcription approach currently, but it also actually handles sending letters through the VoiceBox platform along with additional proofreading and human support options. So it doesn't need the Gentu draft write back and offers some more support options around the workflow. Next up is iScribe, who they've actually just launched in the last couple of weeks. iScribe is another very popular specialist-focused AI scribe. Ambient AI scribe that we know a lot of customers were already using. So that's available now and ready to go. And then alongside that, we also have the voice product, our built-in traditional transcription approach as well. There are a couple more options coming soon, and we'll see those as we get into the coming soon section as well. Part of our approach to connecting the ecosystem is bringing you a range of choices. So we are hoping this growing options of different transcription solutions will meet a wide range of practice needs. And so taking a closer look at that editable letter transcription workflow, if you're using one of those marketplace transcription apps, you'll often start with a view of upcoming appointments or today's patients in the apps. And you'll usually have a button or call to action there to start a transcription with those patients' details. Usually that's going to be an ambient AI listening to the consultation and completing that flow in the partner app. This step is new. So previously, where we only had a PDF write back, we've got this write back to the draft letter in Gentu, after which you or your team are able to edit and address the letter and send it out from Gentu. So this step here, I'll take a closer look at just so that you can see what this will look like. And so this is a demo here starting from after the point where the transcription app has pushed the letter into Gentu. So I will go into Gentu and go to results and letters. I'll go to the outgoing correspondence tab, and then I'll go into the draft tab to see incoming drafts. So here I can see a new letter that has come in that needs to be addressed. I can edit that letter, but all of the content there, apart from the blue template items, has come in from one of those transcription partners via the API. If there's any changes I want to make here in Gentu, I can now do that in Gentu. And then I guess one other thing just to draw attention to, that Gentu template was applied when the letter was created, so I can control those templates in Gentu. You can actually have your choice of template in the partner app when you're sending the letter through. So if you use multiple templates, you can choose them there, send it through. But now that the letter has been edited, the next steps are I can I can address that letter. I'll scroll up and select from my contacts. And basically here, the process will pick up just as if the letter had been written in Gentu in the first place. So in this example, I'll mark as ready to review and I'll save, but whatever your normal letter process would pick up from here. And on to the next item. So another new launch in the marketplace. It's just happened in the last couple of weeks. We're quite excited here to launch our first use case that helps automate the patient journey in Marketplace. So a lot of the other items we've looked at so far are really the practice efficiency, but we really want to help you improve that patient experience as well. So back before we launched the Marketplace, we surveyed customers to understand what the most valuable integrations would be, and automating online bookings for patients was one of those top items. So with Healthengine, you can now allow patients to book online 24/7 through your website or Healthengine profile. Healthengine will have up-to-date availability from your appointment book, and new bookings will come through to Gentu in real time, allowing you to maximize your bookings, your utilization of your appointment book, and reduce admin effort for taking and cancelling and managing those bookings as well. Patients can also provide essential information through Healthengine's form solutions that are part of the integration. So they've just launched in a couple of weeks. They're ready to go now for everyone. So please do check that out if you are interested. And what I'll do is I'll step you through a little bit more of how you can use Healthengine and show you the end-to-end journey. I'll start from how you set up the online bookings, and then we'll look at the patient's experience for making a booking and how that comes back into Gentu. So starting with that Gentu setup, you can now configure your appointment types to control which appointment types are available for online bookings. So if I edit one of those, I can switch that setting on or off and choose which appointment types will be used for online availability. And then the second part of that is in the appointment book, when I'm setting up the schedules, I can control which parts of the schedule will be available to Healthengine by assigning the online appointment types to those schedule blocks. So here we've got a new patient block. I'm choosing that new patient appointment type, which has available online. Any schedule that doesn't have that available online setting won't be visible to Healthengine and to patients. So it gives you fine-grained control of what you want to make available for bookings. So moving over to the Healthengine workflow, and so this is from the patient's point of view. They'll start either from your website or from your Healthengine profile. They'll be able to select the relevant appointment type. I'll just quickly point out there is an extra layer of configuration in Healthengine, so this won't just show all of your Gentu appointment types as they are. You've got a bit of control here of how that's displayed and what they're called. If you have multiple practitioners available, they'll be able to select the appropriate practitioner. And then based on those selections, the patient will see the appropriate available time slots. The patient will then be able to select that appropriate time and proceed with the booking. And patients will also be able to fill out a registration form and capture their details online as well. Patients can provide details of their referral, adding the practitioner and the clinic details. Again, this is another thing you can configure. You can make this required if you want it to be required to submit the referral at booking time. You can leave it out depending on your needs and the different types of appointments that you want to be bookable online. As part of that, patients can also upload a PDF or a photo of their referral as well. That will come through to Gentu. And finally, Healthengine can also take payments. So if you have appointment types where you want to take prepayments from patients, you can also put that in place. And then coming back to the Gentu side, once the patient has completed their booking, the appointment will be automatically created directly into the Gentu appointment book. When you view the appointment, you'll be able to see clearly that that appointment was created by Healthengine as well. So you know that that's come in from an integration partner, and specifically Healthengine. It's apologies not pictured in the screenshot, but you'll also get some details, additional details about that appointment coming through in the notes. And then the referrals will come through to the incoming documents folder, just as if they'd come through from secure messaging or similar to that. They'll come into the same place. And the patient details, basically, if it was a brand new patient to the practice, the patient record will be created in Gentu. If it's an existing patient, the patient record will be matched and the appointment booked against that existing patient. And also those details for the patient demographics will be able to come through to the patient record in either case. And so that covers the what's new and improved section. And before I hand back to Eden, we'll look at what's coming soon with Gentu. And there's a couple of marketplace items that I will talk about before handing back. So we'll actually continue with that theme of automating the patient journey and talk a little bit more about patient forms and some partners that are coming up soon. So back when we surveyed practices for the most in-demand integrations, number one by quite a margin was patient registration forms. And in fact, the number two item was actually digital consent as well. And so we're quite excited that very soon Consentic will launch in the marketplace with a range of solutions, including both patient registration forms and digital consent workflows. It'll address both of those two highest requested integrations. So Consentic is a comprehensive platform for informed consent, patient registration, education, digital patient forms, and surveys. And with that registration forms feature, Consentic will directly update the patient demographic fields, reducing the need for data entry from handwritten forms or copy and pasting from a separate forms process into Gentu, hopefully really streamlining that pain point of getting the automation around updating patient details. If you'd like to see more about Consentic, so we recently did a lunch and learn webinar with Consentic demoing both the patient registration and consent workflows as well. So that's available, but also keep an eye out as they will be launching quite soon, and we'll announce that through the normal channels soon. And ConsultMed. So as Neve mentioned at the beginning, connecting the disconnected health ecosystem has been a really important focus for us. We think ConsultMed will have a big impact here. ConsultMed is a secure referral management platform that streamlines healthcare workflows. It connects primary care to specialists in both directions, so we can have referrals going both ways. ConsultMed is in beta right now, and they're working towards a launch as soon as possible. You can visit the marketplace to register your interest with ConsultMed at the moment, or otherwise, likewise to Consentic, keep an eye out in the next few weeks for further announcements. And then the last item on the marketplace side, we have Heidi Health, which is another very popular ambient AI scribe. We've had quite a few requests for this one, and we want to bring our customers choice. So Heidi are building now. They're not yet in beta, so launch timing is not quite locked down, but we do expect that they'll move fairly quickly. So again, keep an eye out for this one coming soon. And with this, I'll hand back to Eden now for what else is coming up in Gentu.
Thank you, Chris. Just waiting for, there we go, control of the screen. Sorry, folks, just a little bit of a lag getting that to move. Here we are, fantastic. Thanks again. So keeping with our focus here on more comprehensive digital experiences, it is very, very exciting to let everyone know we are well underway with changes to support emailing practitioners, other members of the patient care team directly from Gentu. So we had previously had some challenges with providing this functionality in Gentu, ensuring everyone in our security teams, our legal teams were comfortable with any data risks. At the same time, we have for a while seen a huge amount of value in being able to make this change. And we know that a lot of practices have been working around emailing to practitioners by saving letters as PDFs, then attaching them via their practice email. And, obviously that's a clunky and time-consuming experience. So by sending from Gen2, we're definitely able to remove those extra steps. And by password protecting outgoing emails, we're in a comfortable place when it comes to reducing the risks practices face if sending unprotected documents. So when an email is sent out from Gen2, we'll also be able to provide visibility of which practitioner a letter is from, as well as which member of the practice team has sent the email for them. And this will all happen within the audit record in Gen2. So we're very excited to close an important gap here around transparency and auditability of practice processes. We're also taking an opportunity to look at our default email password structure here. And I'm sure there's going to be many people on the call that are familiar with that. Our old format was a mixture of numbers and letters. So if we were looking at today's date as an example, the format would have been DD and then MMM as letters and then YYYY as numerals. So I'd be looking at something like 21 capital M lowercase AR 2025. It's been challenging for practices to explain to patients, and our new password structure will be a far simpler numeric only format. So for today's date, we'd be looking at 21032025. We're hoping that makes a significant difference in terms of reducing the number of calls that are coming into practices when people can't figure out how to get their content open. One of the most important inputs into how we prioritize is ensuring practices remain compliant with legislative changes. And for us, this has meant e-prescribing has been a very strong focus this quarter. We do have a finite period of time to complete this work. So version 2.3 is the current conformance profile, and this will be deprecated at the end of June this year. So it's great to be able to let everyone know we're actually entering into our testing phase with ERX, and we'll continue to provide updates as we move through this testing process. So as well as providing an up-to-date and secure e-prescribing tool for our practitioners, this work allows us to continue to deliver the benefits of fully digital end-to-end patient experiences, and also to leverage the health ecosystem to make that happen. There will be some minor workflow additions to allow practitioners to record additional pharmacy details in the workflow and also to select ROA preferences where there are multiple routes available for an item. We also had a lot of feedback with our initial MIMS release that the data that was available for cloud products was structured a bit differently to the data that was available for desktop products like Genie. And this was particularly frustrating when prescribing items like injectables, pen devices, or inhalers. So we have been working closely with the MIMS team as they've made updates here. And we'll be looking at releasing new data at the same time to bring additional clarity around those choices for prescribers. So as a SaaS product, there are specific conformance items from ADHA and ERX that are designed to ensure the security of user credentials. For this reason, we will be making multi-factor authentication mandatory for e-prescribing in Gen 2 when our changes are released. So we would strongly recommend everybody uses MFA to add an extra layer of security to your login credentials. It's quick and easy to set up, and there's plenty of help available there on our knowledge base. But our data tells us that only about 20% of prescribers are using MFA at the moment. So if you are e-prescribing, please do take a look at setting this up in the coming weeks so that we can ensure that there is no disruption to EP when changes are released. Now, we're also using our focus on e-prescribing as an opportunity to make some other highly requested changes in our prescribing workflows. And the first big ticket item here is the introduction of quick scripts. So for anyone that's familiar with quick scripts in Genie, you'll know that this is a feature that allows prescribing frequently used medications with minimal effort because you can include additional data points like dose, frequency, quantity, repeats, and patient instructions as stored data that you've already filled in. So it's select, fill in the entire medications form, and you're able to prescribe from there. There will be some variables where patient-specific choices are required, but we certainly hope that this really optimizes, the ability to move quickly through this workflow. I'm happy to announce that this is underway now, and we're expecting a release in the coming quarter. Another sort of frequent request has been for product information documents. So PI data will be available for MIM subscribers in the medication info dropdown that currently shows our CMI. I have actually seen this feature working end-to-end in one of our development environments. They are at the point where they're just wrapping up some testing, and you can look forward to a release here in the coming weeks. So moving into our clinical area, prescribing obviously happens within clinical. It is a clinical workflow. We're leveraging the fact that we have a team in this space to really get our team focused again on how we can start to make some more significant clinical changes. There's some broad themes here around us shaping a modern and flexible clinical experience for practitioners. In particular, we want to ensure that there is room to read and consume information, as well as for you to record insights and observations. We want our clinical area to be as configurable as it needs to be for individual practices to ensure that they have the right data in the right place for themselves, so that we can minimize the need to scroll or go searching for additional information. Look, and ultimately, we'd hope that this means practitioners can spend less time being focused on Gen2, more time focused on their patients. Looping back very quickly to e-requests and the introduction of alternate lab claiming, we hope is going to be a huge step change in this space. So alternate lab claiming, supports greater flexibility of patients choosing where they get their test done. So with our initial releases, if your test was sent to a Sonic lab, it needed to be fulfilled there unless you had a paper copy that you could take somewhere else. What will happen now is that patients can present their e-request barcode at any ACL, Helios, or Sonic lab. So just like you could with an original paper request. And this can be done by accessing the PDF in the e-request link, or with the barcode that's provided there. So this change, obviously comes with the added advantage of being able to track patient compliance and the status of e-requests across any labs, and to ensure that requests and tests have been done. So, if you had sent an e-request previously to Sonic, but your patient took their paper to Helios and got their test done, there was no visibility back. So we're really hoping this closes that loop for everybody. The last thing I'm keen to talk about today is an opportunity for us to get back into appointments and referrals, hopefully in the coming quarter. So as a starting point, what we're hoping to explore, firstly, is addressing feedback around supporting multiple procedure types, differentiated colors for procedure, looking at some simpler navigation options. Throughout this call, I guess, Neve, Chris, and myself have talked about, how we can better connect a disconnected health ecosystem. So it's obviously very important for us to recognize where we could connect the different jobs and tasks that are actually happening within our product as well. It's not just about how we connect more broadly. There's an inner system of things that we need to make a nice tight as well. So with this in mind, we're also investigating updates in our referrals workflow, and ideally we want to be able to optimize that patient journey through your practice, from an incoming letter through to a referral, through to appointments, and then on to invoicing. So I do look forward to bringing further updates in this space in the coming quarter. At the same time, we're very, very open to feedback. Please, if you do have any questions, anything that we're able to assist with beyond this call, please do not hesitate to reach out to us at any point.